what we're looking towards is that as hopefully these two vaccines get approved, because we still have to obviously look at the clinical data, the clinical trials, make sure that our regulatory colleagues are comfortable and approve them. And the other vaccines, hopefully, if they also get approved and get rolled out later in the year, certainly we're looking at hopefully covering the vast majority of the Canadian population, quote, by the end of next year.
Canadian public health officials, as you heard there, are cautiously optimistic after two potential vaccines appear to be highly effective. But even after one is approved, the distribution for those vaccines will be a massive logistical effort. The World Health Organization is leading efforts to ensure developing countries have equitable access to vaccines as well. For more on that, we've reached Dr. Peter Singer. He's a special advisor to the World Health Organization's Director General, and he joins us from Geneva. Hi, Dr. Singer. Good to have you with us tonight.
Thank you very much. It's great to be on.
I wanted to start off and get your perspective on lots of the news we've seen over the last week around vaccines and some promising early results from two companies or two candidates specifically. How optimistic are you right now, based on what you've seen, about the development of a successful vaccine sometime next year?
Well, I think the news is very encouraging, and not just for a particular vaccine, but for vaccines generally. That early interim signal shows probably that many of the vaccines are against the right target, and it bodes very well. But there's a big step from vaccines to vaccination, and we face a daunting operational and logistical challenge in the world. And hopefully that's a challenge that will come very soon for many Canadians and people around the world.
Yeah, I'm sure fingers are crossed for many people. I think it's, we've taken a very narrow look on our show in the past few days at how distribution and that process from candidate to vaccination actually happens or will happen in this country. There are still some questions, or quite a few questions left to be answered. I know you're looking at it from more of an international perspective. What are the big questions that you think, kind of, if you look at it globally, still need to be addressed?
Well, the first question, of course, is the safety and efficacy. And this is really an unprecedented scientific effort. More than 200 candidates, more than about 50 in human trials, 10 in late-stage human trials, a couple with good news, as you mentioned. Beyond safety and efficacy, the issue of equitable distribution of this global good. If what WHO advocates is that vaccines are a global good, and that it's much better to vaccinate some people in all countries rather than all people in some countries, that saves lives, and it's good for everyone around the world, including in Canada.
So I take from that, and this discussion surely has been going on for a while in this country as well, that those more developed countries need to play a role in making sure those in less developed countries have access to the vaccination as well.
Yes, and here WHO has led the development with partners of something called the Access to COVID Tools Accelerator, whose goal is, as the name implies, to accelerate the development of vaccines, diagnostics, and drugs, and ensure their equitable distribution. And Canada and the Government of Canada has been a very strong partner in that, and is among the biggest supporters and contributors. And that's something that is very, very much appreciated by WHO and I think people around the world.
I think the Director General, and correct me if I'm wrong, yesterday of the WHO said that when it comes to that accelerator that you're referencing, another $4.2 billion is needed pretty urgently, and then a further $23.9 billion will be required in 2021. Canada has already obviously contributed. Do you think that countries like Canada will have to step it up even further?
I think all countries of the world will need to contribute more to fill that funding gap, because that's what's missing at this point. And just to put those numbers in context, Vashi, so you talked about the $4.2 billion, the $23.9 billion in 2021. Your numbers are absolutely right. But to put that in context, compare that with the trillions, more than 10 trillion that's spent on stimulus spending. The cost in lives and in livelihoods of this pandemic, and the only way to solve that economic problem is to solve the public health problem. Vaccines are very promising, and closing that funding gap is key, as well as continuing with the public health fundamentals.
I'm wondering what you would say to, I find it interesting that during this whole process, and it's not surprising probably, but people have looked inward, right? In trying to make sure that their own countries and their own, fellow citizens are taken care of, that they have the PPE that they need, that they'll get vaccinated. You're trying, and many others in governments and in multilateral institutions are trying to make the argument that we shouldn't just be looking out for ourselves, right? That it's more beneficial to make sure others are taken care of as well. I'm just wondering, to those who right now are worried about, making sure their own countries have enough, how do you convince them that they should also be worrying about something else?
Well, obviously there's an argument in charity, and Canadians are charitable people, but there's a very, very strong argument in self-interest. None of us is safe until all of us is safe. The national security of Canada relies on dealing with the pandemic in every country in the world, because viruses don't have passports, they don't respect borders, they travel around the world quickly. And if Canadians want to be safe, we have to make sure that COVID is tackled in every country in the world. And if I may say, Vashi, we're talking a lot about vaccines, and the hope, and that's all very true. But this is a very challenging time for Canadians. We understand that. And please, let's not forget the fundamental public health measures of testing, isolating and supporting cases, tracing and quarantining contacts, and then, of course, the masking, avoiding crowded indoor spaces, washing your hands, physical distancing, and as a last resort, the so-called lockdown or restriction of movement. That's the way many countries around the world have actually tackled the virus. We'll need to do that until we have a vaccine, while the vaccine is rolling out, and after the vaccine is rolling out. And that's a very, very important message.
Yeah, it's an important reminder, especially because that vaccine isn't coming tomorrow or even the next day. It's definitely further off than that. Just before I let you go, Dr. Singer, as far as just circling back to the question of making sure less developed countries are part of this as well, the U.S. has largely been absent from many of those sort of multilateral efforts in that vein. Though now that we're going to see a change in administration, Joe Biden has promised to rejoin the WHO. Do you anticipate that will make a big difference in those efforts?
The United States and the World Health Organization have had a fantastic relationship for 73 years. It's important for the security and prosperity and health of people around the world and in the United States. Long may that continue. And to your specific question, last week in his address to the World Health Assembly, Dr. Tedros congratulated President-elect Biden and Vice President-elect Kamala Harris and indicated his wish that the WHO and the U.S. government work very, very closely together going forward.
Okay, Dr. Singer, I'll leave it there. Thanks for your time. Really appreciate it as always.
Thank you so much, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.